If you've ever known pain, my friends, and I mean real pain, then you know that you're more or less willing to do anything to get it to stop. For people with jaw pain, really there's only one place to go, we've come to discover. Please welcome to the show Dr. Keller from Keller Professional Group and his patient, Mr. John Berkheimer. Gentlemen, how are you this morning?
Good morning, Matt.
Dr. Keller, thanks to your tutorials over the course of the last few months, here's my understanding of TMJ. A lot of it at the root has to do with poor jaw alignment or a bad bite, right?
Correct.
So when people come into your office, they're complaining of pain, and it can be neck pain, head pain, things that you might not necessarily associate with your teeth directly. What are you able to do for these folks?
Well, the first thing we try to do is find out what causes the problems. Then we try and find a better structural and postural position to stop the compromise and compensation, get our patients back to being stable, back to being comfortable, and then we maintain that long term.
So it's all about finding the right bite position and then kind of working backwards from there.
Yes, sir.
Now, for some patients, that may mean removing teeth.
Yes.
For some patients, that may mean putting in implants, right?
Correct.
So talk me through this implant process a little bit.
Well, an implant is just a replacement for a broken tooth. John, for example, has all of his natural teeth. He had a bridge for a number of years and unfortunately broke it off. And we ended up replacing that then with implants and a new bridge.
And John, what was that process like? Because I got to be honest, sounds like it would hurt.
Well,
Really?
surprisingly, Matt, it didn't. It started with the extraction of the teeth, and then bone graft, and then the implants, and the testing for the fit, and then the bridge. For me, it was relatively pain-free.
How long ago did you have this done?
Finished up about 2 months ago.
And how do you feel now?
Great.
No kidding.
Feels like my own teeth. That's
Does it
correct.
really? You can't tell any difference
I
at all?
cannot
Natural
tell.
bite, everything lines up?
Absolutely.
Now, I wonder about the fit, because you hear, especially with dentures and some other appliances, sometimes there's slipping, sometimes there's catching. So how does this all work?
Well, some of the more difficult problems we face are people who have lost multiple teeth or all of their teeth. And over the course of time, their bite sort of changes, modifies, etc.
Yeah.
And I know a lot of people wear dentures, but if that bite doesn't fit with where the joints and muscles belong, something has to give. So what we try to do is reestablish where their bite should be, and then we rebuild their bite long term to maintain that stability.
So in the case of these implants, and you brought this model along with you, how does this physically attach to the person?
Well, if you'll take it off, we'll show you.
I'll take it off. That's on there pretty snug, Doc. Holy cow. There it is. I guess that's supposed to happen, right? You don't want them to come off easily.
No, no. The idea is that if you put it on, you'll feel how it snaps in place.
Oh, yeah. Oh.
So that just gives us stability that you just don't have in other ways.
That's great. That's what you want. And before we let you go, I understand that within a few years of getting implants, there's about a 50-50 chance that you're going to have some gum disease problems.
Right. So what we've also developed is a method to treat that using a thing called a perio tray, which fits over the implants, and then the patient wears that once or twice a day, 10-15 minutes, and they deliver medications to control the bacteria that cause gum disease, and also medications that allow us to stop bone loss and actually regenerate bone.
How about, it's amazing what you guys can do. And John is testifying. He's a believer at this point. Thank you very much, gentlemen, for being here. We appreciate it.
Thank you.
If you're experiencing any of these problems, discuss them with your dentist first, or you can give Dr. Keller a call, of course, 314-638-4190. He'll help you find out why you have pain and what can be done about it. Or you can always check out his website, drdwaynekeller.com, to learn more about TMJ. Claire, folks that are suffering with it really need the help.
Yeah, very helpful. Matt, thank you.